Let me go to Dr. Anand Bhan for his initial thoughts before I posit a couple of questions. Dr. Bhan, Ms. Iyer has put forward some of those issues. I want to get your sense of how you look at things.
Sure. Thank you for having me. So I think as Yamini was rightly pointing out, this pandemic is sort of showing India and actually many other LMICs the problems with their own health systems. We've seen through our experience with the pandemic how ill-prepared we are, how resilience is a major lacuna in our health systems. When we are hit with such a pandemic, it tells us that we have shortage of infrastructure, we don't have enough hospitals, we don't have enough beds, we don't have enough ICUs, ventilators, etc. But also, probably more worryingly, we don't have enough human resources to even man the infrastructure that we have. So we've struggled in being able to provide care, and obviously we also struggled in being able to do public health steps like contact tracing effectively. Now, over the last few months, the governments have tried both at the federal level and at the state level in ramping up some of this infrastructure. But the challenge, obviously, is that these kind of preparations take time, and you cannot create human resources overnight. Linked to that also is the fact that public health, investments have been scanty in many of our countries in South Asia, including in India, for decades now. And this is something which public health advocates have been arguing for many years now, but hopefully this pandemic will in fact force our governments to invest more in health and ensuring that we have adequate infrastructure and human resources available. The second issue, I think, is the issue of economy, which again, Yamini is an expert in that domain. But as we know, the economy has taken a hit. That is partly the reason why we have gone into unlock, and the unlock also brings its own challenges. The rapid rise in infections over the last few weeks, as you were rightly pointing out in your introductory remarks, is partly a function of that unlock happening. As more and more people are going out, there is a higher chance of transmitting infections, and the numbers are rising. And we're seeing, quite worrying trends as in terms of the numbers.